Cancer Center is basically all providers who care for cancer at St. Louis University. Within that, we have what we consider the sarcoma team or the sarcoma center. So there's subspecialists, myself being one of them, who really focus on the treatment of soft tissue or bone sarcoma. It's important to remember when you're talking about sarcoma, you're talking about a very rare disease, and that's both bone and soft tissue sarcomas. It's not very common, it's fairly rare. So you have to have somebody or a team that's very comfortable treating soft tissue or bone sarcomas in order to get the optimal care and the optimal outcome. So coming to St. Louis University, where we have an entire system and organization set up for soft tissue or bone sarcoma care, that's a really unique advantage, because coming here, we can provide the full spectrum of treatment that's required. Usually we try to combine the appointments so you're not seeing multiple providers on different days. It's usually all of us combined collectively, and that includes the medical oncologist, either the adult or the pediatric medical oncologist, the pathologist who specializes in sarcoma pathology, the radiation oncologist, the interventional radiologist. So there's a whole team of us within the Cancer Center who really treats sarcoma specifically, and we meet weekly to talk about patients. We have a combined conference where we make sure every patient gets discussed, and we have a plan that collectively makes sense for the patient. When I see a patient who comes to me with a bone or soft tissue tumor, ultimately the important thing to remember is very individualized, because the treatment for each type of disease, whether you're talking about a bone sarcoma or a soft tissue lesion, whatever it may be, it's really very unique. And it's unique to the patient and a lot of the patient factors and also the tumor factors. So for me, the first thing I need to do is figure out what they have and then figure out what is the best treatment for them individually. And sometimes that treatment is just surgery. Sometimes that treatment involves a whole lot of other treatment options, including chemotherapy, plus or minus radiation, and so forth. So you really have to know what the patient has and what's best for that individual patient, because the treatment is so varied depending on what that diagnosis is. And regardless of what it is, whether it's just a simple surgery or something far more complicated, I know we have the team in place and the providers necessary at St. Louis University to give them that full spectrum of care, so that at the end of the day, whatever that treatment may be for them, they're going to get the best care and a care that I can go home feeling comfortable is appropriate for them.